Hello and welcome to your 2020 Open Enrollment. Today we're going to go over some of the benefits that are available to you. We'll go over the Aetna medical plans, the new Delta dental plans, your vision plan, and your voluntary coverages. Open enrollment starts today, November 12th, and ends November 20th, which means everybody should return either an enrollment form or a waiver form by November 20th, with no exceptions. Eligibility. You and your family are eligible for coverage. So employees working 30 plus hours, your legal spouse, your domestic partner, or children up to the age of 26 are also covered. The benefits you are reviewing today will begin January 1st, 2020 until December 31st, 2020. During those 12 months, you cannot make any changes unless you experience a qualifying event. Some of those qualifying events are marriage, divorce, birth of a child, adoption, loss of coverage, or if you are become eligible for Medicare or Medicaid, that is also a qualifying event. Make sure you contact your team here at CBR within 31 days from the date of the event to make those changes. Next, we're going to go over the medical plans that are available to you. Again, these benefits begin January 1st, 2020, which means your deductible will reset on the first of the year. Your first plan is called your Open Access Managed Choice High Deductible Health Plan 5000. So this plan is deductible first. So all visits, doctor visits, urgent care, emergency room, and some prescriptions, you will have to pay your deductible before you get covered. This plan has a $5,000 individual deductible, $10,000 family deductible. If you should meet that in a calendar year, you will go into coinsurance. So at that point, Aetna will pick up 80% of the cost, and you will pick up 20% of the cost until you reach your maximum out-of-pocket. If you should reach your maximum out-of-pocket in a calendar year, you will be into 100% coverage, again, in a calendar year and in network. Your office visits for sick visits or specialist visits, your urgent care, emergency room, those are all going to be covered after your deductible. Your preventative care services, maintenance medication, and contraceptives are all covered prior to your deductible. If you should meet your deductible, you do have copays available for your prescriptions. A high deductible health plan allows you to open up a health savings account, which are pre-tax dollars you set aside into an account. You can use the money for medically qualified expenses such as copays, prescriptions, series of vision products, vision care, dental work, things of that nature. Also, that health savings account is your money. It stays with you, goes with you. There is no use it or lose it provision. We will go over that in detail in the next few slides. The next plan is called the Open Access Managed Choice 6350. 6350 being the individual deductible, $12,700 being the family deductible. If you should meet that deductible in the calendar year, you have also met your out-of-pocket maximum, which at that point you will be covered at 100%. Your doctor visit, such as a sick visit, is going to be a $25 copay. Your specialist visits, your urgent care, and your emergency room are all going to be subject to your deductible first. Again, preventative care is covered at 100% under this plan. You also have a 30-day prescription, so generic drugs, $3 or $10, preferred brand name, $35, your non-preferred brand name, $60, and any specialty medications such as injectables, you will going to pay 25% of the cost up to $250. On this plan, you do not need to meet your deductible in order to obtain your drugs at a copay. Next, we're going to go over the next two plans that are available to you. The first plan is the Open Access Managed Choice 2500. 2500 being the individual deductible, 5000 being the family deductible. Then you're going to go into coinsurance or cost share with Aetna. At that point, you will pick up 20% of the cost until you reach your out-of-pocket maximum. Your preventative care, again, is covered at 100%. Your office visits for this plan, you have 5 visits, whether it's a regular doctor office visit, sick visit, or specialist visit, 5 a year at $35 copay. Now, if you go over the 5 visits per the year, then you're going to pay the contracted negotiated rate. On this plan, your urgent care and emergency room services are going to be subject to your deductible first. So you're going to pay the contracted negotiated rate with those providers. Prescription drugs, again, available with 30-day retail supply. The same generic copays as the previous plan. Preferred brand name, $35. Your brand name, $60. And specialty drugs, 25%. The last plan is the Open Access Managed Choice 3000. This plan has a $3,000 individual deductible, $6,000 family deductible, and then you're going to go into cost share. 70% paid by Aetna, and then you will pay 30% until you reach that out-of-pocket maximum of $6,350 for an individual, $12,700 for the family. On this plan, if you need regular doctor visits, sick visits, it's a $40 copay, and your specialist is a $60 copay. Keep in mind on all of the Aetna plans, you can self-refer to specialists. You do not need a primary care physician to write you a referral to any specialist. You can do it yourself. At this plan, your urgent care is going to be covered at a $75 copay and your emergency room, $250 copay. Again, prescriptions at a copay. So if you enroll in the high deductible health plan, the Open Access Managed Choice 5000, you can open a health savings account. The health savings account helps you in many ways. So it is a pre-tax deduction. Whatever amount you elect comes out of your check pre-tax, lowering your taxable income. Again, that money is your money. It's 100% portable. It stays with you and it grows with you. Now, if you have your UMB account already open for today, you do not need to open a new account. If you have not opened the UMB account and you want to do so for the 2020 plan year, please do so before the first of the year so we have an account to put in your pre-tax deductions into. So under IRS rules, there is a maximum that you can set aside pre-tax deductions. For an individual, it's $3,550, and for a family, which under IRS rules is 1 plus, it could be 1 plus a spouse or 1 plus a child or an entire family, is $7,100. Now, if you are 55 or over, you can add an additional $1,000 to that annual maximum. A couple of rules to follow. So first of all, you have to be enrolled in a high deductible health plan to open an HSA account. Number 2, you cannot be enrolled in a non-qualified plan. Number 3, you cannot be enrolled in any part of Medicare. And number 4, you cannot be somebody else's dependent on their tax returns. A health savings account is also a pre-tax deduction. So similar to an HSA, you elect an amount to be deducted from your paycheck throughout the year. The difference with the flexible spending account is that money is front-loaded. So it's available in your account to use immediately at the beginning of the year. Then that amount is broken by number of pay periods. One of the major differences is on a flexible or with a flexible spending account, if you leave the company, you do not keep that money. It stays at the company. Number 2, this plan has a maximum of $500 carryover into the 2021 plan year. So keep that in mind when electing your amount. So again, any amount over $500 on December 31st, 2020 will be forfeited. Okay, you can also use this money for copays, medical expenses, dental work, vision, prescriptions, medical supply, things of that nature. Keep in mind, if you enroll in the high deductible health plan, you cannot enroll in the flexible spending account. It has to be one or the other. You also have the ability to enroll in the dependent care flexible spending account. Again, pre-tax dollars that you set aside that go into a holding account to either pay your provider or pay yourself back. This money is made available as it comes out of your check. Aetna resources that are available to you. You have the Nurse on Call 24/7, 365. Really good resource if you have questions in regards to prescriptions, where to seek medical care, or if you need to go to the ER or urgent care or wait for your provider. You also have some discounts available on the website that I highly recommend you visit. Gym discounts available throughout the U.S. Like everybody else, Aetna also has their mobile app. You can download it to your telephone, so you have your ID card. You can find a pharmacy and urgent care anywhere you travel. You also have telemedicine through Teladoc. So if you enroll in any of the Aetna plans, you also have the ability to enroll into the Teladoc program. So this is a 24/7, 365 board certified physicians that you can speak to or Skype with. So they can treat things like the flu, allergies, sinus infections, pink eye, ear infections, UTIs, and much, much more. It is a copay, so if you enroll in any of the medical plans, whatever the primary care physician copay is, that's what you will pay for the visit. If you enroll in the high deductible health plan, your visit is $45. There is also dermatology available, psychiatry, and psychologists available via telephone or Skype. Next, we're going to go over the new Delta dental plans that are available January 1st. So the first plan is the PPO plan. So this plan has an annual maximum of $1,500 to use towards dental services for yourself and any member of your family enrolled. Your deductible only comes into play with basic services and major services. Preventative care, which includes your 2 cleanings twice a year, is going to be covered at 100%. Your basic services and your major services, that's where you're going to have to pay that deductible once a year. Whether it be for a major service or a basic service, it's a $50 individual deductible, $150 family deductible. Now, if you go into that cleaning and they find a cavity, at that point you will be subject to the deductible. And number 2, you will pay 20% of cost, and at Delta Dental will pick up 80% of the cost. Major services such as a crown, it's going to be a 50-50 cost share between yourself and Delta Dental. Again, utilizing that annual maximum of $1,500. Additionally, on this plan, there's additional $1,000 for child orthodontia. It's a lifetime benefit for all children enrolled in the plan. So this plan covers the same in and out of network. The difference with out of network is a provider does not have an agreement or a signed contract with Delta Dental, which means they will gladly accept whatever Delta Dental pays them. However, you may be subject to balance billing. The second plan is called the Delta Dental DHMO plan. This plan works very similar to your TDA plan. So this plan again has no annual deductible, no annual maximum. Your preventative care is covered at 100%, your cleanings twice a year, etc. Everything else is going to be subject to a fee schedule. So there you see a sample of the fee schedule. This is the actual schedule for Delta Dental. So you do have to, like today's TDA plan, pick a provider, enroll with that provider, and you have to stick with that provider. If you do not choose a provider, Delta Dental will assign one based on your home zip code. Anytime during the calendar year, you may change that provider. Now, you and each member of your family, you may all have different providers. You don't have to have the same provider. Very important there. So all of your diagnostics, your preventative is going to be covered at 100%. There's a small copay for $5 for a re-evaluation. So that's after the first evaluation. If you want to go in and see the doctor or it's a post-operative office visit, it's going to be a small $5 copay. In your email, you will also find the full fee schedule. Go through it. It covers all of your dental services, from your preventative care to orthodontia for adults and children, teeth bleaching, cavities, root canals, crowns, dentures, implants, all of that is covered at a fee. So please review that fee schedule. You also have your TDA program that is still available. If you're currently enrolled in the TDA program, please let us know that you'd like to continue on your enrollment form, and we'll continue to make sure that you're enrolled in that program. Here are some resources that are available through Delta Dental of Arizona. So Delta Dental has a website that you can go to, enroll in. You can see your explanation of benefits, download or print ID cards, find providers, all on that website. Delta Dental also has a mobile app that you can download. Again, it'll serve the same purpose where you can find a provider and you can have your ID card at your disposal. Vision plan. So this is a new vision plan. What has changed is the network and the frequency of the frames, for example. So your exam is available every 12 months. So under the current plan, if you already went and got your exam, that's fine. In 2020, you can go at any time. You don't have to wait the full 12 months because it is a new contract, it is a new group number, it is a new ID. So make sure you have your new ID with you when you go see your provider. You will need that. The network has changed. It is a much bigger network and a much richer network, which means IMID will pay the providers more money, so you will see your dollars go further under this plan. Your frames are available every 12 months. That's a change. So today's program, it's every 24 months. Now they're available every 12 months. So zero copay, and you have a $120 allowance to use towards those frames. Anything above that, you'll get a 20% discount. Your lenses are available every 12 months, single vision, bifocal, and trifocal at a $10 copay. Additionally, if any treatments to your lenses like tintin, polycarbonate, it's now at a copay versus percentage of charge. That's new as well. Contact lenses are available every 12 months in lieu of lenses for your glasses, and that's an $80 allowance, 15% off the balance over $80. And then any medically necessary contact lenses will be covered at 100%. Again, the biggest change here is the frequency in your frames going from 24 to 12, and now it is called the Insight Network. So very important to note that. Voluntary life and accidental death and dismemberment is available. So the first time we presented the life insurance, if you enrolled, you can increase your life insurance as long as you do not go over the 5 times annual earnings up to $200,000. You will not be subject to any medical underwriting. You may enroll in up to 5 times annual earnings up to $500,000, but anything above the guarantee issue will be subject to medical underwriting. And this is only if you enrolled the first time around. If you did not enroll and you wish to do so now, any amount will be subject to medical underwriting. Disability is available to you. This is a voluntary program. So your short-term disability covers up to 60% of your pre-disability earnings up to $1,000 a week. The benefit qualification, so when benefits starts to pay, is at the 14th day, and this is for off the job, so accident and sickness not related to the job. And the benefit duration is a maximum of 11 weeks. There are some pre-existing limitations, so read those carefully. Your voluntary long-term disability, same, covers 60% of your pre-disability monthly earnings up to $7,500. The elimination period, or the time you have to wait for the benefits to start to pay, is 90 days. And this benefit does last until normal Social Security retirement age. Again, pay attention to those pre-existing limitations. You also have AFLAC. Again, AFLAC is a coverage that does not coordinate with any of the insurance. It pays you directly for any of the items listed here. If you're enrolled today and just continue to keep that enrollment, you do not need to do anything. If you wish to enroll and meet with a counselor, please email or call Jose as soon as possible so he can call you or have somebody call you to go over the benefits. Legal Shield and ID Shield is still available. If you're enrolled today, you will maintain that enrollment. If you wish to enroll, you do need to go online, and you can find that information in your enrollment packet. And also pet care is available. Again, you do have to go online and enroll for that pet care. And the cost of these is listed on the flyer in your enrollment packet. Again, everybody must complete an enrollment or a waiver by November 20th, no exceptions. The voluntary life and disability forms only if you're going to, one, make a change or enroll for the first time. Your flexible spending account, not your health savings account or HSA, but your flexible spending account. This is an annual election. The benefits do not roll forward unless you re-enroll. And your health savings account, if you're enrolling for the first time, please review your benefit guide. Follow the instructions on there on how to open your account with UMB Bank, and let us know how much you want us to put there. If you do not open that account, we will not be able to deduct any of the pre-tax elections unless you open that account. Very important there. Just as a reminder, all the forms are due by November 20th. If you have any questions, please do not hesitate to call your team at CBR.